Now, the federal government has announced it will halve the number of subsidised psychology sessions, so that's from 20 to 10 per year. For a lot of people, seeing someone for your mental health has now become quite normal, which is a great thing, a much needed part of life. And this will hurt people.
And it'll really hurt people. And I'm not seeing transparency on this. So I've read quite a lot about this because I think it's a really interesting subject. We knew that through COVID we went up from 10 to 20. Yeah. My issue with it, and I can't see, the government is saying, Mark Butler is saying that because you give 20, it means that people are using up those sessions and that people from lower socioeconomic groups are not getting in and getting the initial sessions that they need. But then if you talk to psychologists, they say that the industry needs other things. I think we need more psychologists trained. I also wonder whether having a psychology session could be a tax-deductible expense because it's a good thing for sole traders, for people who own small businesses. I just think we need creative thinking around how we can deliver psychological services, mental health services. I'm really disappointed in this. I'm not seeing the clearness that I think we need around it.
And I get the government can't pay for everything, but this is so important. I think particularly after COVID, every survey after survey, young people in particular have suffered immensely.
Yeah, they have, Erin. And the statistics on this, from what I understand, are interesting because we get this impression from the government that the whole thing's being swamped and the money's going under the floor and everything. But I think the number is something, it's around about 15% go for the 11 to 20 sessions. Most still do 1 to 10. So it's not as if it's being fully utilised as it is. And this argument from the minister that, oh, well, most of the people using these services are in well-off areas, therefore it's not equitable. Well, that's not the answer. What you could say is, well, okay, good on them for using it. How do we get the services into the areas that aren't utilising it or don't have access? You don't take it off one just so you're equal with the other. You improve the other.
Absolutely.
You know, lift the whole...
And you're right, there's a real shortage at the moment. It is almost impossible to get into someone, and if you do, you're often waiting months.
And through the pandemic, much longer. And they're saying that it is getting quicker, but there's just not that follow-through and that care that can continue on, and particularly, as you say, around youth and also eating disorders, apparently. Trying to see somebody in the eating disorders sphere is really tricky.
It's one of the biggest issues that this country faces.